brings us to your weekly capsule of health information. We call it Your Healthy Dose. It's August. August is Missouri Breastfeeding Month to help educate moms, families, and communities on the benefits and the support services possibly available to you. Joining us here in the studio, Diane Bibb and Marla Whelan. Thanks for joining us. Appreciate it.
Good morning.
And welcome aboard. This is, I want to say, it's a topic that, gosh, moms-to-be and dads and the rest of society need to talk about and engage in and promote.
Yes, breastfeeding offers just unmatched benefits to both mothers and babies. The American Academy of Pediatrics recently issued a policy statement on breastfeeding stating the known benefits are so important, infant nutrition really should be looked at as a public health issue, not just a lifestyle choice.
So this is one of the important things that we should promote breastfeeding in this society because of the benefits. And there's a number of them. The list is long.
Yeah, the list is long for both mothers and babies.
Yeah.
For babies, breastfeeding does decrease the risk of being hospitalized by 72% for lower respiratory tract infections, and it decreases gastrointestinal infections by 64%. And interestingly enough, that effect lasts for 2 months after stopping breastfeeding.
Wow.
There's a reduction in SIDS for breastfed babies, decrease in allergies, and kind of a hot topic today is a reduction in both adolescent and adult obesity among breastfed babies.
And there's been some research that has proven that just came out. Also, a reduction as far as the risk for diabetes.
Yeah, and that's for both mothers and babies, a reduction in the rate of diabetes. There's a reduction in childhood leukemia and lymphoma for breastfed babies, and preterm babies have a significant decrease in necrotizing enterocolitis, which, even though it's a very specific population, it can be deadly to preterm babies. And we know when they receive mother's milk, there's a significant reduction. So it's very important for babies.
And even preterm babies benefit from mother's milk.
Yes.
Too, very much so. Why is it that we as a society are so polarized on this topic? Can you shed any light on that or make sense of it?
Well, I think for a long time we've looked from the healthcare professional standpoint and from society as a whole in that formula and breast milk are equivalent, and it doesn't really matter. It's more of a lifestyle choice, whatever mom wants to do. And I think the research has come out showing that breast milk is truly better, even though formula has been made where babies can survive on formula. It, as far as health benefits, it's not equivalent. And for the first time, major public health organizations, the CDC, the Surgeon General, have come out and said they're not equivalent, and we really need to be looking at promoting breastfeeding. I think when you start talking about breastfeeding, it does bring up interesting things in our society, and people are uncomfortable with it. But we need to start changing what the norm and our cultural norm's been bottle feeding, and we need to start looking at breastfeeding as being the cultural norm.
Well, back until a bottle was developed, for feeding purposes, I mean, that's what moms did. And that's all they knew. That's all they had. So, what goes around comes around, I guess. Let's get back to the basics here, shall we? And talk about some good things. So what are some of the current recommendations on breastfeeding?
Well, the American Academy of Pediatrics recommends that babies be exclusively breastfed for the first 6 months of life, and then when they start their baby food, they can still breastfeed too, and they recommend still to breastfeed up to a year or longer.
And even longer. What about these stories about 5 and 6 year olds?
They're out there.
They're still being breastfed.
There's benefits immunologically. There's benefits for toddlers to continue breastfeeding. Average age around the world for weaning is 2 to 3 years of age.
Really?
Yeah. So there's health benefits for those babies.
Okay. My 7.5-year-old, I think, was weaned at about maybe 8-9 months. But at 6 months, it was supplemental. It wasn't exclusive. So, okay, some great recommendations there. So tell us a little about the Chris Coons Women's Care Center at Hannibal Regional Hospital.
Well, we're a baby-friendly hospital. We're the only one currently in the state of Missouri. It's a World Health Organization UNICEF designation that is worldwide. Looking at, they actually come in and do site visits, and they designate the hospital if you're following certain practices. CDC has just recently jumped on board and issued grant money to 90 hospitals in the country to become baby friendly. It's a new project because they're realizing that the practices with the Baby Friendly Hospital Initiative are very evidence-based to provide moms and babies with the very best start in life.
So that's another benefit to Trick or Treat for UNICEF, which is what I did. Many that little orange box and everything. Every penny does help. So the World Health Organization and UNICEF talk about this baby friendly, which is a trademark phrase, I guess. What is baby friendly?
Baby Friendly is following 10 steps to successful breastfeeding. It's recognizing hospitals that provide very special care for moms and babies. We've changed our practices in Hannibal over the last few years, and the very first thing moms notice is immediately after birth, the babies are placed skin to skin on mom's chest, and they stay there for the first few hours after birth until that first feeding takes place. Babies actually transition better. They have better heart rates, better respiratory rates, their blood sugars are better, and they just do a better job transitioning from life inside mom's uterus to life outside when they're left skin to skin.
The mom's body controls, her temperature is controlled to make the baby the temperature it needs to be. The dad can't do that. No one else can do that, just the mom.
Just the mommies.
Right
well,
then.
there's always a special bond between between mommy and child.
Yeah.
It's kind of interesting. So you're one of few baby-friendly hospitals in the entire country.
Right now we are. There's only 143 in the country.
Oh, wow.
But they're looking at a huge increase as the research has come out showing that this is a better way. So it's just a change in our maternity care practices in the U.S.
So in addition to spending a couple of hours with mom after being born, what other kind of care services do you offer?
We room in. Our
Yeah.
moms and babies all room in together. So from birth until they go home, that mom and baby stay together. And it really sets us up to be able to provide better support, education, services for those new families.
So do you still call it a maternity ward? Okay. I didn't know if you maybe have changed the moniker for that.
No?
But okay, all right. So there are quite a few benefits there. And how soon do mommy and baby go home, or does it depend on? I mean, you want to get them home as soon as possible. I guess it depends on the circumstance and how mommy's progressing through the healing process.
There's a few that want to go home the next day. Most of them stay 2 nights
2 nights.
and go home. Even the C-sections, they can stay longer, but a lot of them go home in 2 days too.
Okay. Breastfeeding support. Now, I know this may sound kind of weird, but sometimes moms just simply don't know what to do.
No, sometimes the babies don't either.
So how do you help in that regard?
Well, we spend a lot of time with them, and then when they go home, we have support group for them twice a week, Monday evenings at 5 and Wednesday mornings at 10. And Diane carries a phone on her hip constantly that's a warm line, and the moms are given this number, and they can call her anytime, 24/7.
Wow. Okay. Good to know. Well, you've been here for a while, and I haven't heard the phone go off yet. You must be doing a
I
good
silenced
job.
it. It's in
Oh,
my
you
it's in my
silenced it.
purse.
Okay. I don't know if you want to do that or not. Maybe a desperate mom trying to call in. So the new moms do have a lot of support. You talked about the support group and the assistance 24/7 that is available. I think that is absolutely marvelous, and that's probably why you've been given this designation, the one and only in the state of Missouri.
What were we,
Excellent.
the 80?
We were the 83rd in the country to
83rd in the
become baby
country.
friendly.
That's outstanding.
Now, there's some countries in the world that practically all of their hospitals are baby friendly. They've just had that kind of culture
Yeah,
for a long time.
very true. I would imagine Europeans.
Yeah.
Yeah.
Okay.
Yeah.
All right. So for more information, if we want to learn more about your services, how do we get more? Do we call? Do we go on the internet? Do we buzz you 24/7?
Yep. Well, the warm line is available for moms 24/7, and that phone number is 573-406-2122. For more information about the unit and the services we provide, people can call 573-248-5161. They can look online at our website, hrhonline.org. And we also have a Facebook page, HRH Breastfeeding Support.
Okay, good to know. How about businesses? What do you think about businesses that don't like it when moms come in and feed?
Well, we're really working with a lot of employers,
Okay.
not only to support their moms that work there when they come back to work and are continuing breastfeeding, but also to support women that come into businesses, whether they're retail stores, restaurants, because we're working on changing the culture that that's the normal way to feed a baby.
Sure.
And there are state laws that protect moms and say that anywhere a mother can be publicly, she can breastfeed her baby.
Yeah. Okay. As she should. All right. Great information there. And again, that's Diane Bibb and Marla Whelan. Great to have you here this morning.